Welcome to Part 6 of our 862-question NCLEX-RN 2026 practice series. In this video, you'll work through questions 251 to 350, featuring realistic NCLEX-style practice questions designed to strengthen your clinical judgment, reinforce essential nursing concepts, and improve your exam readiness. Answer each question before the correct answer is revealed. Then review the detailed explanations to understand the rationale behind every choice and build confidence for test day. Let's continue your journey toward passing the NCLEX-RN with confidence. Question 251. A client is 2 hours post-ventriculoperitoneal shunt placement. How should the nurse position the client? A. Head of bed elevated 30 degrees on non-operative side. B. Head of bed elevated 30 degrees on operative side. C. Bed flat on operative side. D. Bed flat on non-operative side. Answer: D. Bed flat on non-operative side. Explanation: A. Elevation of head on non-operative side would be the position for the late postoperative period. B. Positioning on operative side puts pressure on the suture lines and on the shunt valve. Elevation of head in immediate postoperative period may cause rapid reduction of cerebrospinal fluid. C. Placement on operative side puts pressure on the suture lines and shunt valve. D. Flat position on non-operative side in the immediate postoperative period prevents pressure on shunt valve and rapid reduction in cerebrospinal fluid. Question 252. A 79-year-old client with Alzheimer's disease is exhibiting significant memory impairment, cognitive impairment, extremely impaired judgment in social situations, and agitation when placed in a new situation or around unfamiliar people. The nurse should include the following strategy in the client's care. A. Maintain routines and usual structure and adhere to schedules. B. Encourage the client to attend all structured activities on the unit, whether she wants to or not. C. Ask the client to go to an activity once. If she gives no response right away, change the question around, asking the same thing. D. Give the client 2 or 3 choices to decide what she wants to do. Answer: A. Maintain routines and usual structure and adhere to schedules. Explanation: A. Alzheimer's clients cope poorly with changes in routine because of memory deficits. Schedule changes cause confusion and frustration, whereas adhering to schedules is helpful and supports orientation. B. Insisting that the client go to all unit activities may antagonize her and increase her agitation because of cognitive impairments. It may be better to allow the client time for calming down or distraction rather than to insist that she attend every activity. C. When repeating a question, allow time first for a response, then use the same words the second time to avoid further confusion. D. The nurse should avoid giving several choices at once. Cognitively impaired clients will become more frustrated with making decisions. Question 253. A physician's order reads, 0.25 normal saline at 50 ml per hour until discontinued. The nurse is using a microdrip tubing set. How many drops per minute should the nurse administer? A. 1 GTT/min. B. 5 GTT/min. C. 50 GTT/min. D. 100 GTT/min. Answer: C. 50 GTT/min. Explanation: A. This answer is a miscalculation. B. This answer is a miscalculation. C. 50 GTT/min. D. This answer is a miscalculation. Question 254. A client was prescribed a major tranquilizer 2 months ago. 1 month ago she was placed on benztropine, Cogentin. What would indicate that benztropine therapy is effective? A. Smooth, coordinated voluntary movement. B. Tremors. C. Rigidity. D. Muscle weakness. Answer: A. Smooth, coordinated voluntary movement. Explanation: A. Benztropine is prescribed to decrease or alleviate extrapyramidal side effects of major tranquilizers. Smooth, coordinated voluntary movement indicates minimal extrapyramidal side effects. B. Tremors are an extrapyramidal side effect. C. Rigidity is an extrapyramidal side effect. D. Muscle weakness is an extrapyramidal side effect. Question 255. At 38 weeks gestation, a client is in active labor. She is using her Lamaze breathing techniques. The RN is coaching her breathing and encouraging her to relax and work with her contractions. Which one of the following complaints by the client will alert the RN that she is beginning to hyperventilate with her breathing? A. I am cold. B. I have a backache. C. I feel dizzy. D. I am nauseous. Answer: C. I feel dizzy. Explanation: A. Cold is not a symptom of hyperventilation. This could be due to the temperature of the room. B. Backache is not a symptom of hyperventilation. This is probably due to the gravid uterus and its effect on the back muscles, or it may be due to the client's position in bed. C. Dizziness is the first symptom of hyperventilation. It occurs because the body is eliminating too much CO2. D. Nausea is not a symptom of hyperventilation. It could be a symptom of pain. Question 256. At 32 weeks gestation, a client is scheduled for a fetal activity test, non-stress test. She calls the clinic and asks the RN, "How do I prepare for the test I am scheduled for?" The RN will most likely inform her of the following instructions to help prepare her for the test. A. You need to know that N4 is always started before the test. B. You will need to drink 6 to 8 glasses of water to fill your bladder. C. Do not eat any food or drink any liquids before the test is started. D. You will have to remain as still as you possibly can. Answer: D. You will have to remain as still as you possibly can. Explanation: A. N4 line is not started in a non-stress test, because this test is used as an indicator of fetal well-being. This test measures fetal activity and heart rate acceleration. B. The bladder does not have to be full prior to this test. It is not a sonogram test where a full bladder enables other structures to be scanned. C. It has been proved that eating or drinking liquids prior to the test can assist in increasing fetal activity. D. Any maternal activity will interfere with the results of the test. Question 257. The client has been in active labor for the last 12 hours. During the last 3 hours, labor has been augmented with oxytocin because of hypoactive uterine contractions. Her physician assesses her cervix as 95% effaced, 8 cm dilated, and the fetus is at 0 station. Her oral temperature is 100.2 F at this time. The physician orders that she be prepared for a cesarean delivery. In preparing the client for the cesarean delivery, which one of the following physician's orders should the RN question? A. Administer meperidine, Demerol, 100 mg IM 1 hour prior to the delivery. B. Discontinue the oxytocin infusion. C. Insert an indwelling Foley catheter prior to delivery. D. Prepare abdominal area from below the nipples to below the symphysis pubis area. Answer: A. Administer meperidine, Demerol, 100 mg IM 1 hour prior to the delivery. Explanation: A. Meperidine is a narcotic analgesic medication that crosses the placental barrier and reaches the fetus, causing respiratory depression in the fetus. A narcotic medication should never be included in the preoperative order for a cesarean delivery. B. Oxytocin infusion would be discontinued if client is being prepared for a cesarean delivery because the medication would not be needed. C. The bladder is always emptied prior to and during the surgical intervention to prevent the urinary bladder from accidentally being incised while the uterine incision is made. D. The abdominal area is always prepared to rid the area of hair before the abdominal incision is made. Abdominal hair cannot be sterilized and could become a source for postoperative incisional infection. Question 258. A first trimester primigravida is diagnosed with anemia. The nurse should suspect that this anemia is a result of A. Mother's increased blood volume. B. Mother's decreased blood volume. C. Fetal blood volume increase. D. Increase in iron absorption. Answer: A. Mother's increased blood volume. Explanation: A. Maternal blood volume increases at the end of the first trimester leading to a dilutional anemia. B. Maternal blood volume increases. C. Fetal blood volume is minimal in the first trimester. D. Increased iron absorption would facilitate the manufacturing of erythrocytes and decrease anemia. Question 259. A 3-year-old child is admitted with a diagnosis of possible non-communicating hydrocephalus. What is the first symptom that indicates increased intracranial pressure? A. Bulging fontanelles. B. Seizure. C. Headache. D. Ataxia. Answer: C. Headache. Explanation: A. Bulging fontanelles are a symptom of increased intracranial pressure in infants. B. Seizure is a late sign of increased intracranial pressure. C. Headache is a very early symptom of increased intracranial pressure in the child. D. Ataxia is a late sign of increased intracranial pressure. Question 260. A client was admitted with rib fractures and a pneumothorax, which were sustained as a result of a motor vehicle accident. A chest tube was placed on the left side to reinflate his lung, and he was transferred to a client unit. 24 hours after admission, he continues to have bloody sputum, develops increasing hypoxemia, and his chest X-ray shows patchy infiltrates. The nurse analyzes these symptoms as being consistent with A. Pneumonia. B. Pulmonary contusions. C. Pulmonary edema. D. Tension pneumothorax. Answer: B. Pulmonary contusions. Explanation: A. Pneumonia may be reflected by patchy infiltrates. In addition, fever, an increasing white blood cell count, and copious sputum production would be present. B. Blunt chest trauma causes a bruising process in which interstitial and alveolar edema and hemorrhage occur. This is manifest by gradual deterioration over 24 hours of arterial blood gases and the continued production of bloody sputum. Patchy infiltrates are evident on chest X-ray 24 hours post-injury. C. Pulmonary edema usually results from left heart failure. It is manifest by pink, frothy sputum, increasing dyspnea, tachycardia, and crackles on auscultation. D. Tension pneumothorax is a potential complication for someone with rib fractures and a chest tube. It is manifest by diminished breath sounds on the affected side, rapidly deteriorating arterial blood gases in the presence of an open airway, and shock that is unexplained by other injuries. Question 261. After the RN is finished the initial assessment of a newborn baby and after the initial bonding between the newborn and the mother has taken place in the delivery room, the RN will bring the newborn to the well-baby nursery. Before the newborn is taken from the delivery room and brought to the well-baby nursery, the RN makes sure that which of the following interventions was completed? A. The physician verifies the exact time of birth. B. The nurse counts the instruments and sponges with the scrub nurse. C. The nurse instills prophylactic ointment in the conjunctival sacs of the newborn's eyes. D. The nurse makes sure the mother and her newborn have been tagged with identical bands. Answer: D. The nurse makes sure the mother and her newborn have been tagged with identical bands. Explanation: A. The delivery room personnel are responsible for verifying time of birth. B. The scrub and circulating nurses count sponges and instruments. C. This intervention is done in the nursery. D. Tagging the mother and infant with identical bands is of utmost importance. The mother wears one band, and the newborn wears two. Identical numbers on the three bands provide identification for the newborn and the birth mother. Every time the newborn is brought to the mother after delivery, those bands are checked to be sure that the numbers are identical. Question 262. A nurse is performing a vaginal exam on a client in active labor. An important landmark to assess during labor and delivery are the ischial spines because A. Ischial spines are the narrowest diameter of the pelvis. B. Ischial spines are the widest diameter of the pelvis. C. They represent the inlet of birth canal. D. They measure pelvic floor. Answer: A. Ischial spines are the narrowest diameter of the pelvis. Explanation: A. The fetal descent, or station, is determined by the relationship of the presenting part to the spine. B. Ischial spines are the narrowest measurement. C. Ischial spines measure the pelvic outlet. D. Pelvic floor measurement is not related to fetal descent. Question 263. A client's congestive heart failure has been treated, and he will soon be discharged. Discharge teaching should include instruction to call the physician if he notices a 2 pounds weight gain in a 24-hour period. Increased weight gain may indicate A. A diet too high in calories and saturated fat. B. Decreasing cardiac output. C. Decreasing renal function. D. Development of diabetes insipidus. Answer: B. Decreasing cardiac output. Explanation: A. Increased calories may result in weight gain, but there is no indication in this question that this man's diet has changed in a way that would result in increased calories. B. Decreasing cardiac output stimulates the renin-angiotensin-aldosterone cycle and results in fluid retention, which is reflected by weight gain. C. Decreasing renal function may result in fluid retention, but this question gives no indication that this man has any renal problems. D. Profound diuresis occurs with diabetes insipidus, which results in weight loss. Question 264. A newborn is admitted to the newborn nursery with tremors, apnea periods, and poor sucking reflex. The nurse should suspect A. Central nervous system damage. B. Hypoglycemia. C. Hyperglycemia. D. These are normal newborn responses to extrauterine life. Answer: B. Hypoglycemia. Explanation: A. Central nervous system damage presents as seizures, decreased arousal, and absence of newborn reflexes. B. In a diabetic mother, the infant is exposed to high serum glucose. The fetal pancreas produces large amounts of insulin, which causes hypoglycemia after birth. C. Hypoglycemia is a common newborn problem. Increased insulin production causes hypoglycemia, not hyperglycemia. D. These are not normal adaptive behaviors to extrauterine life. Question 265. On admission, the client has signs and symptoms of pulmonary edema. The nurse places the client in the most appropriate position for a client in pulmonary edema, which is A. High Fowler. B. Lying on the left side. C. Sitting in a chair. D. Supine with feet elevated. Answer: A. High Fowler. Explanation: A. High Fowler position decreases venous return to the heart and permits greater lung expansion so that oxygenation is maximized. B. Lying on the left side may improve perfusion to the left lung but does not promote lung expansion. C. Sitting in a chair will decrease venous return and promote maximal lung expansion. However, clients with pulmonary edema can deteriorate quickly and require intubation and mechanical ventilation. If a client is sitting in a chair when this deterioration happens, it will be difficult to intervene quickly. D. The supine with feet elevated position increases venous return and will worsen pulmonary edema. Question 266. A male client has been hospitalized with congestive heart failure. Medical management of heart failure focuses on improving myocardial contractility. This can be achieved by administering A. Digoxin, Lanoxin, 0.25 mg per every day. B. Furosemide, Lasix, 40 mg per every morning. CO22L/min via nasal cannula. D. Nitroglycerin, Nitral, 1 inch topically every 4 hours. Answer: A. Digoxin, Lanoxin, 0.25 mg per every day. Explanation: A. Digoxin is a cardiac glycoside given to clients in heart failure to improve their myocardial contractility. B. Furosemide is a loop diuretic given to clients in heart failure to promote diuresis. C. O2 is given to clients in heart failure to increase oxygenation and to prevent or treat hypoxemia. D. Nitroglycerin is a nitrate given to clients in heart failure to increase their cardiac output by decreasing the peripheral resistance that the left ventricle must pump against. Question 267. A client had a vaginal delivery 3 days ago and is discharged from the hospital on the 2nd day postpartum. She told the RN, "I need to start exercising so that I can get back into shape. Could you suggest an exercise I could begin with?" The RN could suggest which one of the following: A. Push-ups. B. Jumping jacks. C. Leg lifts. D. Kegel exercises. Answer: D. Kegel exercises. Explanation: A, B, C. This exercise is too strenuous at this time. D. This exercise is recommended for the first few days after delivery. It helps to stimulate muscle tonus in the area of the perineum and the area around the urinary meatus and vagina. Question 268. A 35-year-old client is admitted to the hospital with diabetic ketoacidosis. Results of arterial blood gases are pH 7.2, PAO 290, PACO 245, and HCO 316. The nursing assessment of arterial blood gases indicate the presence of A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Answer: D. Metabolic acidosis. Explanation: A. Respiratory alkalosis is determined by elevated pH and low PACO2. B. Respiratory acidosis is determined by low pH and elevated PACO2. C. Metabolic alkalosis is determined by elevated pH and HCO3. D. Metabolic acidosis is determined by low pH and HCO3. Question 269. A laboring client presents with a prolapsed cord. The nurse should immediately place the client in what position? A. Reverse Trendelenburg. B. Fowler's. C. Trendelenburg. D. Sims. Answer: C. Trendelenburg. Explanation: A. Reverse Trendelenburg position increases pressure on the perineum. This position will not relieve cord pressure. B. Fowler's position increases perineal pressure. Cord pressure would not be relieved. C. Trendelenburg position will decrease perineal pressure. Cord compression will be decreased and increase in fetal blood flow occurs. D. Sims position does not relieve pressure on cord or perineum. Question 270. After an infant is delivered by cesarean delivery and placed on the warmer, the RN dries and assesses the infant. At 1 and 5 minutes after birth, the RN does the APGAR scoring of the infant. The RN knows that because this infant was delivered by cesarean section, he is at increased risk for having which one of the following? A. Cold stress. B. Cyanosis. C. Respiratory distress syndrome. D. Seizures. Answer: C. Respiratory distress syndrome. Explanation: A. The infant is placed on the warmer and dried after birth. Cold stress occurs when the infant is not dried and kept warm. B. The fact that this infant was born by cesarean delivery does not place him at a greater risk for cyanosis than an infant delivered vaginally. Cyanosis occurs when infants cannot oxygenate their blood after the umbilical cord is severed. C. Infants born by cesarean delivery are at a higher risk for developing respiratory distress syndrome because these infants do not pass through the pelvis, where the chest is compressed and fluid is able to escape from the lungs. D. Cesarean delivered infants are not at greater risk for seizures than infants delivered vaginally. Question 271. Painless vaginal bleeding in the last trimester may be caused by A. Menstruation. B. Abruptio placentae. C. Placenta previa. D. Polyhydramnios. Answer: C. Placenta previa. Explanation: A. Menstruation should not occur during pregnancy. B. Abruptio placentae is marked by painful vaginal bleeding following a premature placental detachment after 20th week of gestation. C. A low-lying placenta separates from the uterine wall as the uterus contracts and cervix dilates. This separation causes painless bleeding in the 7th to 8th month. D. Polyhydramnios is excessive amniotic fluid. Question 272. On a mother's second postpartum day after having a vaginal delivery, the RN is preparing to assess her perineum and anus as part of her daily assessment. The best position for the client to be placed in for this assessment is A. Sims. B. Fowler's. C. Prone. D. Any position that the RN chooses. Answer: A. Sims. Explanation: A. The Sims position is the best position for assessment of the perineum and anus. The top leg is placed over the bottom leg, and the RN raises the upper buttocks to fully expose the perineum and anus. B. Fowler's position is a sitting position, and the perineum and anus would not be exposed. C. The prone position would have the mother on her back, and her perineum and anus would not be exposed. D. The position of choice should always be the Sims. Question 273. A 1000 milliliters dose of D5W12 normal saline is to be infused in 8 hours. The drop factor for the tubing is 60 GTT/min. How many drops per minute should the nurse administer? A. 75 GTT/min. B. 100 GTT/min. C. 125 GTT/min. D. 150 GTT/min. Answer: C. 125 GTT/min. Explanation: A. This answer is a miscalculation. B. This answer is a miscalculation. C. 125 GTT/min. D. This answer is a miscalculation. Question 274. A 67-year-old client will be undergoing a coronary arteriography in the morning. Client teaching about post-procedure nursing care should include that A. Bed rest with bathroom privileges will be ordered. B. He will be kept NPO for 8 to 12 hours. C. Some oozing of blood at the arterial puncture site is normal. D. The leg used for arterial puncture should be kept straight for 812 hours. Answer: D. The leg used for arterial puncture should be kept straight for 812 hours. Explanation: A. Bed rest will be ordered for 812 hours post-procedure. Flexing of the leg at the arterial puncture site will occur if the client gets out of bed, and this is contraindicated after arteriography. B. The client will be able to eat as soon as he is alert enough to swallow safely, and that will depend on what medications are used for sedation during the procedure. C. Oozing at the arterial puncture site is not normal and should be closely evaluated. D. The leg where the arterial puncture occurred must be kept straight for 812 hours to minimize the risk of bleeding. Question 275. A client presents to the psychiatric unit crying hysterically. She is diagnosed with severe anxiety disorder. The first nursing action is to A. Demand that she relax. B. Ask what is the problem. C. Stand or sit next to her. D. Give her something to do. Answer: C. Stand or sit next to her. Explanation: A. This nursing action is too controlling and authoritative. It could increase the client's anxiety level. B. In her anxiety state, the client cannot rationally identify a problem. C. This nursing action conveys a message of caring and security. D. Giving the client a task would increase her anxiety. This would be a late nursing action. Question 276. A 55-year-old man has recently been diagnosed with hypertension. His physician orders a low-sodium diet for him. When he asks, "What does salt have to do with high blood pressure?" the nurse's initial response would be: A. The reason is not known why hypertension is associated with a high-salt diet. B. Large amounts of salt in your diet can cause you to retain fluid, which increases your blood pressure. C. Salt affects your blood vessels and causes your blood pressure to be high. D. Salt is needed to maintain blood pressure, but too much causes hypertension. Answer: B. Large amounts of salt in your diet can cause you to retain fluid, which increases your blood pressure. Explanation: A. This response is untrue. B. Decreasing salt intake reduces fluid retention and decreases blood pressure. C. Salt does not have an effect on the blood vessels themselves, but on fluid retention, which accompanies salt intake. D. This response is untrue. Question 277. A pregnant client continues to visit the clinic regularly during her pregnancy. During one of her visits while lying supine on the examining table, she tells the RN that she is becoming lightheaded. The RN notices that the client has pallor in her face and is perspiring profusely. The first intervention the RN should initiate is to A. Place the examining table in the Trendelenburg position. B. Assess the client to see if she is having vaginal bleeding. C. Obtain the client's vital signs immediately. D. Help the client to a sitting position. Answer: D. Help the client to a sitting position. Explanation: A. This position would cause the gravid uterus to bear the increased pressure of the vena cava, which could lead to maternal hypotension, in turn causing the client to continue to have pallor and to feel lightheaded. B. This would not be the first intervention the RN should initiate. The RN should understand the supine position and its effect on the gravid uterus and vena cava. C. The RN's first intervention should be one that helps to alleviate the client's symptoms. Obtaining her vital signs will not alleviate her symptoms. D. This would move the gravid uterus off of the client's vena cava, which would alleviate the maternal hypotension that is the cause of her symptoms. Question 278. A cardinal symptom of the schizophrenic client is hallucinations. A nurse identifies this as a problem in the category of A. Impaired communication. B. Sensory perceptual alterations. C. Altered thought processes. D. Impaired social interaction. Answer: B. Sensory perceptual alterations. Explanation: A. Impaired communication refers to decreased ability or inability to use or understand language in an interaction. B. In sensory perceptual alterations, an individual has distorted, impaired, or exaggerated responses to incoming stimuli, i.e., a hallucination, which is a false sensory perception that is not associated with real external stimuli. C. An altered thought processes problem statement is used when an individual experiences a disruption in cognitive operations and activities, i.e., delusions, loose associations, ideas of reference. D. In impaired social interaction, the individual participates too little or too much in social interactions. Question 279, a primigravida is at term. The nurse can recognize the second stage of labor by the client's desire to A. Push during contractions. B. Hyperventilate during contractions. C. Walk between contractions. D. Relax during contractions. Answer: A. Push during contractions. Explanation: A. The second stage of labor is characterized by uterine contractions, which cause the client to bear down. B. Slow, deep, rhythmic breathing facilitates the laboring process. Hyperventilation is abnormal breathing resulting from loss of pain control. C. The client should remain on bed rest during labor. D. Contractions result in discomfort. Question 280, an 11-year-old boy has received a partial thickness burn to both legs. He presents to the emergency room approximately 15 minutes after the accident in excruciating pain with charred clothing to both legs. What is the first nursing action? A. Apply ice packs to both legs. B. Begin debridement by removing all charred clothing from wound. C. Apply Silvadene cream, silver sulfadiazine. D. Immerse both legs in cool water. Answer: D. Immerse both legs in cool water. Explanation: A. Ice creates a dramatic temperature change in the tissue, which can cause further thermal injury. B. Charred clothing should not be removed from wound first. This creates further tissue damage. Debridement is not the first nursing action. C. Applying silver sulfadiazine cream first insulates heat in injured tissue and increases potential for infection. D. Emergency care of a thermal burn is immersing both legs in cool water. Cool water permits gradual temperature change and prevents further thermal damage. Question 281, the physician is preparing to induce labor on a 40-week multigravida. The nurse should anticipate the administration of A. Oxytocin, Pitocin. B. Progesterone. C. Vasopressin, Pitressin. D. Ergonovine maleate. Answer: A. Oxytocin, Pitocin. Explanation: A. Oxytocin is a hormone secreted by the neurohypophysis during suckling and parturition that produces strong uterine contractions. B. Progesterone has a quiescence effect on the uterus. C. Vasopressin is an antidiuretic hormone that promotes water reabsorption by the renal tubules. D. Ergonovine produces dystocia as a result of sustained uterine contractions. Question 282. A 70-year-old client has pneumonia and has just had a respiratory arrest. He has just been intubated with an 8 mm endotracheal tube. During auscultation of his chest, breath sounds were found to be absent on the left side. The nurse identifies the most likely cause of this as A. Inappropriate endotracheal tube size. B. Left-sided pneumothorax. C. Right mainstem bronchus intubation. D. Pneumonia. Answer: C. Right mainstem bronchus intubation. Explanation: A. Appropriate endotracheal tube sizes for adults range from 7.0 to 8.5 mm, B. Pneumothorax could be indicated by an absence of breath sounds on the affected side. However, in a recently intubated client, the first priority would be to consider tube malposition. C. During intubation, the right mainstem bronchus can be inadvertently entered if the endotracheal tube is inserted too far. Left mainstem bronchus intubation almost never occurs because of the angle of the left mainstem bronchus. D. Breath sounds for someone with pneumonia may be decreased over the areas of consolidation. However, in a recently intubated client, the first priority would be to consider tube malposition. Question 283. A client has consented to have a central venous catheter placed. The best position in which to place the client is the Trendelenburg position. The reason is that the Trendelenburg position A. Allows the physician to visualize the subclavian vein. B. Reduces the possibility of air embolism. C. Reduces the possibility of hematoma formation. D. Makes the procedure more comfortable for the client. Answer: B. Reduces the possibility of air embolism. Explanation: A. The subclavian vein is not visible during central line insertion regardless of the client's position. B. The Trendelenburg position reduces the possibility of air embolism because it places slight positive pressure on the central veins. It also distends the veins, and distension facilitates insertion. C. This response is untrue, it has no effect on hematoma formation. D. This position is not necessarily more comfortable for the client, and many clients, especially those who may be short of breath, may find the position uncomfortable and difficult to maintain. Question 284. At 30 weeks gestation, a client is admitted to the unit in premature labor. Her contractions are every 5 minutes and last 60 seconds, her cervix is closed, and the suture placed around her cervix during her 16th week of gestation, when she had the McDonald procedure, can still be felt by the physician. The amniotic sac is still intact. She is very concerned about delivering prematurely. She asks the RN, "What is the greatest risk to my baby if it is born prematurely?" The RN's answer should be A. Hyperglycemia. B. Hypoglycemia. C. Lack of development of the intestines. D. Lack of development of the lungs. Answer: D. Lack of development of the lungs. Explanation: A. Any infant would be at risk for hyperglycemia because the infant's liver is missing the islets of Langerhans, which secrete insulin to break down glucose for cellular use. Prematurity is not an added risk for hyperglycemia. B. Both premature and mature infants can be at risk for hypoglycemia if their mother had gestational diabetes during pregnancy or entered the pregnancy with diabetes mellitus. These infants are exposed to high levels of maternal glucose while in utero, which causes the islets of Langerhans in the infant's liver to produce insulin. After birth, when the umbilical cord is severed, the generous amount of maternal blood glucose is eliminated. However, there is continued islet cell hyperactivity in the infant's liver, which can lead to excessive insulin levels and depleted blood glucose. C. Mature infants are born with an immature GI system. The nervous control of the stomach is incomplete at birth, salivary glands are immature at birth, and the intestinal tract is sterile. This is not the greatest risk to the premature infant. D. Infants born before 37 weeks gestation are at greatest risk for an insufficient amount of surfactant in the alveoli system of the lungs. Surfactant helps to prevent lung collapse and ensures stability of the respiratory system so that the infant can maintain his own respirations once the umbilical cord is severed at birth. Question 285. A schizophrenic client who is experiencing thoughts of having special powers states that I am a messenger from another planet and can rule the earth. The nurse assesses this behavior as A. Ideas of reference. B. Delusions of persecution. C. Thought broadcasting. D. Delusions of grandeur. Answer: D. Delusions of grandeur. Explanation: A. Clients experiencing ideas of reference believe that information from the environment, e.g., the television, is referring to them. B. Clients experiencing delusions of persecution believe that others in the environment are plotting against them. C. Clients experiencing thought broadcasting perceive that others can hear their thoughts. D. Clients experiencing delusions of grandeur think that they are omnipotent and have superhuman powers. Question 286. An elective saline abortion has been performed on a 3-week primigravida. Following the procedure, the nurse should be alert for which early side effect? A. Water satiety. B. Thirst. C. Edema. D. Diabetes insipidus. Answer: B. Thirst. Explanation: A. If the client is experiencing water satiety, there is no more desire for water. B. Absorption of saline into circulation rather than into amniotic sac increases serum sodium and desire for water. C. Edema can be a late side effect caused by water intoxication. D. Diabetes insipidus occurs as a result of deficient antidiuretic hormone. Question 287. A type I diabetic client delivers a male newborn. The newborn is 45 minutes old. What is the primary nursing goal in the nursery during the first hours for this newborn? A. Bonding. B. Maintain normal blood sugar. C. Maintain normal nutrition. D. Monitor intake and output. Answer: B. Maintain normal blood sugar. Explanation: A. Bonding is necessary but would not be the priority with this newborn in the nursery. B. The infant will be at risk for hypoglycemia because of excess insulin production. C. Normal nutrition is a goal for all newborns. D. Monitoring intake and output is necessary but is not the most critical nursing goal. Question 288. A client is diagnosed with organic brain disorder. The nursing care should include: A. Organized, safe environment. B. Long, extended family visits. C. Detailed explanations of procedures. D. Challenging educational programs. Answer: A. Organized, safe environment. Explanation: A. A priority nursing goal is attending to the client's safety and well-being. Reorient frequently, remove dangerous objects, and maintain consistent environment. B. Short, frequent visits are recommended to avoid overstimulation and fatigue. C. Short, concise, simple explanations are easier to understand. D. Mental capability and attention span deficits make learning difficult and frustrating. Question 289. In client teaching, the nurse should emphasize that fetal damage occurs more frequently with ingestion of drugs during: A. First trimester. B. Second trimester. C. Third trimester. D. Every trimester. Answer: A. First trimester. Explanation: A. Organogenesis occurs in the first trimester. Fetus is most susceptible to malformation during this period. B. Organogenesis has occurred by the second trimester. C. Fetal development is complete by this time. D. The dangerous period for fetal damage is the first trimester, not the entire pregnancy. Question 290. At 30 weeks gestation, a client is admitted to the unit in premature labor. Her physician orders that N4 be started with 500 ml D5W mixed with 150 mg of ritidrine stat. The RN prepares the 4 solution with the medication. The RN knows that clients receiving the medication ritidrine 4 should be observed closely for which one of the following side effects: A. Hypoglycemia. B. Hyperkalemia. C. Tachycardia. D. Increase in hematocrit and hemoglobin. Answer: C. Tachycardia. Explanation: A. Ritodrine is a sympathomimetic 2-adrenergic agonist that can cause an elevation of blood glucose and plasma insulin in pregnant women. Hyperglycemia can occur in women with abnormal carbohydrate metabolism because of their inability to release more insulin. B. Hypokalemia can occur resulting from the action of the mimetics. It results from a displacement of the extracellular potassium into the intracellular space. C. Ritodrine causes vasodilation of vessel walls, which can lead to hypotension. The body compensates by increasing heart rate and pulse pressure. D. There is a lowering of serum iron resulting from the action of mimetics to activate hematopoiesis. Question 291. The nurse working with a client who is out of control should follow a model of intervention that includes which of the following? A. Approach the client on a continuum of least restrictive care. B. Challenge client's behavior immediately with steps to prevent injury to self or others. C. Leave the aggressive client to himself or herself, and take other clients away. D. To ensure safety of other clients, place client in seclusion immediately when he or she begins shouting. Answer: A. Approach the client on a continuum of least restrictive care. Explanation: A. Approaching a client's aggressive behavior on a continuum of least restrictive care is in agreement with his or her rights, i.e., verbal methods to help maintain control, medication, seclusion, and restraints, as necessary. B. Approaching a client in a challenging manner is threatening and inappropriate. A non-challenging and calm approach reflects staff in control and may increase client's internal control. C. It is inappropriate to leave an aggressive client who is acting out alone. The nurse should acquire qualified help to prevent client from harm or injury to self or others. D. Moving a client to seclusion immediately for shouting is inappropriate. The nurse should offer the client an opportunity to control self with limit setting. The client should understand that the staff will assist with control if necessary, i.e., quietly accompany out of environment to decrease stimulation and allow for verbalization, employing the least restrictive care model of intervention. Question 292. A client calls the prenatal clinic to schedule an appointment. She states she has missed 3 menstrual periods and thinks she might be pregnant. During her first visit to the prenatal clinic, it is confirmed that she is pregnant. The registered nurse, RN, learns that her last menstrual period began on June 10. According to NCLEX rule, the estimated date of confinement is A. March 17, B. June 3, C. August 30, D. January 10. Answer: A. March 17. Explanation: A. Using NCLEX rule, count back 3 calendar months from the first day of the last menstrual period. The answer is March 10. Then add 7 days and 1 year, which would be March 17 of the following year. B, C, D. This date is incorrect. Question 293. A client experiencing delusion states, I came here because there were people surrounding my house that wanted to take me away and use my body for science. The best response by the nurse would be A. Describe the people surrounding your house that want to take you away. B. I need more information on why you think others want to use your body for science. C. There were no people surrounding your house, your relatives brought you here, and no one really wants your body for science. D. I know that must be frightening for you, let the staff know when you are having thoughts that trouble you. Answer: D. I know that must be frightening for you, let the staff know when you are having thoughts that trouble you. Explanation: A. Focusing on the delusional content does not reinforce reality. B. Pursuing details or more information on the delusion reinforces the false belief and further distances the client from reality. C. Challenging the client's delusional system may force the client to defend it, and you cannot change the delusion through logic. D. Focusing on the feeling can reinforce reality and discourage the false belief. Seeking out staff when thoughts are troublesome can help to decrease anxiety. Question 294. A mother who is breastfeeding her newborn asks the RN, "How can I express milk from my breasts manually?" The RN tells her that the correct method for manual milk expression includes using the thumb and the index finger to A. Alternately compress and release each nipple. B. Roll the nipple and gently pull the nipple forward. C. Slide the thumb and index finger forward from the outer border of the areola toward the end of the nipple. D. Compress and release each breast at the outer border of the areola. Answer: D. Compress and release each breast at the outer border of the areola. Explanation: A. Manipulation of nipples will cause soreness and trauma. B. Pulling the nipples will cause discomfort and soreness. C. Sliding the thumb and index finger forward over the nipple will cause soreness. D. The best method to express milk from the breast is to position the thumb and index finger at the outer border of the areola and compress. This is the location of the milk sinuses. Question 295. A 16-month-old infant is being prepared for tetralogy of phalate repair. In the nursing assessment, which lab value should elicit further assessment and requires notification of physician? A. pH 7.39. B. White blood cell, WBC, count 10,000 WBC/mm3. C. Hematocrit 60%. D. Bleeding time of 4 minutes. Answer: C. Hematocrit 60%. Explanation: A. Normal pH of arterial blood gases for an infant is 7.35–7.45. B. Normal white blood cell count in an infant is 6,00017 500 WBC/mm3. C. Normal hematocrit in infant is 28%–42%. A 60% hematocrit may indicate polycythemia, a common complication of cyanotic heart disease. D. Normal bleeding time is 27 minutes. Question 296. A 40-year-old client is admitted to the hospital for tests to diagnose cancer. Since his admission, he has become dependent and demanding to the nursing staff. The nurse identifies this behavior as which defense mechanism? A. Denial. B. Displacement. C. Regression. D. Projection. Answer: C. Regression. Explanation: A. Denial is the disowning of consciously intolerable thoughts. B. Displacement is the referring of a feeling or emotion from one person, object, or idea to another. C. Regression is returning to an earlier stage of development. D. Projection is attributing one's own thoughts, feelings, or impulses to another person. Question 297. A 45-year-old male client was admitted to a chemical dependency treatment center following legal problems related to alcohol abuse. He states, "I know that alcohol is a problem for some people, but I can stop whenever I want to. I'm never sick or miss work, and no one can complain about me." During the initial assessment, the best response by the nurse would be: A. The fact is you are an alcoholic or you wouldn't be here. B. I understand it took strength to admit yourself to the unit, and I will do my part to help you to stay alcohol-free. C. If you can stop drinking when you want to, why don't you stop? D. It's good that you can stop drinking when you want to. Answer: B. I understand it took strength to admit yourself to the unit, and I will do my part to help you to stay alcohol-free. Explanation: A. Direct confrontation initially is non-therapeutic and may result in the client becoming frustrated and wanting to leave. B. A positive, supportive attitude builds trust, and identifying positive strength raises self-esteem. Offering help allows the client to feel that he is not alone in dealing with problems. C. Asking the client why or to give an explanation for his behavior puts him in a position of having to justify his behavior to the nurse. D. Giving approval or placing a value on feelings or behavior may limit the client's freedom to behave in a way that may displease another. This response may lead to seeking praise instead of progress. Question 298. A client is in active labor and has been admitted to the labor and delivery unit. The RN has just done a sterile vaginal exam and determines that the client is dilated 5 cm, effaced 85%, and the fetus head is at 0 station. She asks if she could have a lumbar epidural now. The epidural is started, and the anesthetic agent used is bupivacaine, Marcaine. After the client has received her lumbar epidural, it is important for the RN to monitor her for which of the following side effects: A. Hypertension. B. Hypotension. C. Hypoglycemia. D. Hyperglycemia. Answer: B. Hypotension. Explanation: A. The medication bupivacaine will cause vasodilation in the vascular system, and this does not result in elevation of the maternal blood pressure. B. The medication bupivacaine will cause vasodilation in the vascular system, and this will result in lowering the maternal blood pressure. C. Bupivacaine does not interfere with the functioning of the endocrine system. D. Bupivacaine does not interfere with the functioning of the endocrine system. Question 299. A newborn has been delivered with a meningomyelocele. The nursery nurse should position the newborn: A. Prone. B. Supine. C. Side-lying. D. Semi-Fowler. Answer: A. Prone. Explanation: A. The prone position reduces pressure and tension on the sac. Primary nursing goals are to prevent trauma and infection of the sac. B. The supine position exerts pressure on the sac. C. Newborns usually cannot maintain side-lying position. D. The semi-Fowler position exerts pressure on the sac. Question 300. A 2-month-old infant is receiving 4 fluids with a volume control set. The nurse uses this type of tubing because it: A. Prevents administration of other drugs. B. Prevents entry of air into tubing. C. Prevents inadvertent administration of a large amount of fluids. D. Prevents phlebitis. Answer: C. Prevents inadvertent administration of a large amount of fluids. Explanation: A. A volume control set has a chamber that permits the administration of compatible drugs. B. Air may enter a volume control set when tubing is not adequately purged. C. A volume control set allows the nurse to control the amount of fluid administered over a set period. D. Contamination of volume control set may cause phlebitis. Topic 4. Question set D. Question 301. The nurse begins morning assessment on a male client and notices that she is unable to palpate either of his dorsalis pedis pulses in his feet. What is the first nursing action after assessing this finding? A. Palpate these pulses again in 15 minutes. B. Use a Doppler to determine presence and strength of these pulses. C. Document the finding that the pulses are not palpable. D. Call the physician and notify the physician of this finding. Answer: B. Use a Doppler to determine presence and strength of these pulses. Explanation: A. Palpating these pulses again in 15 minutes may only result in the same findings. B. Any time during an assessment that the nurse is unable to palpate pulses, the nurse should then obtain a Doppler and assess for presence or absence of the pulse and pulse strength, if a pulse is present. C. Pulses may be present and assessed through use of a Doppler. Absence of palpable pulses does not indicate absence of blood flow unless pulses cannot be located with a Doppler. D. The nurse would only call the physician after determining that the pulses are absent by both palpation and Doppler. Question 302. A client is a depressed, 48-year-old salesman. A serious concern for the nurse working likely to occur is A. In the acutely depressed state. B. When the depression starts to lift. C. In the denial phase. D. During a manic episode. Answer: B. When the depression starts to lift. Explanation: A. The client may be too disorganized in the acute phase to make a workable plan. B. When the depression starts to lift, the client is able to make a workable plan. C. There usually is not a significant denial phase related to depression. Suicide occurs in a state of despair and hopelessness. D. Suicide is uncommon in the manic state. In this state, clients do not feel hopeless, but euphoric and overly confident. Question 303. A client has received digoxin 0.25 mg per daily for 2 weeks. Which of the following digoxin levels indicates toxicity? A. 0.5 nanograms per milliliter. B. 1 nanogram per milliliter. C. 2.0 nanograms per milliliter. D. 3.0 nanograms per milliliter. Answer: D. 3.0 nanograms per milliliter. Explanation: A. 0.5 nanograms per milliliter of digoxin is a subtherapeutic level, not a toxic one. B. 1 nanogram per milliliter is a therapeutic level. C. 2.0 nanograms per milliliter is a therapeutic level. D. Digoxin's therapeutic level is 0.82.0 ing/ml. Digoxin's toxic level is NGT, 2.0 ing/ml. Question 304. A male client was involved in a motor vehicle accident earlier in the day. The nurse caring for him on evenings notices that on admission to the hospital, he lost a lot of blood and required multiple blood transfusions. The nurse would anticipate which blood product would be ordered when a large blood loss has occurred. A. Whole blood. B. Platelets. C. Fresh frozen plasma. D. Packed red blood cells. Answer: A. Whole blood. Explanation: A. Whole blood is the transfusion component of choice when large volumes of blood need to be replaced. Whole blood contains all blood components that are lost during active bleeding. B. Platelet therapy is indicated for thrombocytopenia if the client's platelet count is below 15,000/mm3. C. Infusion of fresh frozen plasma is required when the prothrombin time and partial thromboplastic time are prolonged. D. Packed red blood cells are transfused in instances of anemia with decreases in hematocrit and hemoglobin. Question 305. On an assessment of a client's mouth, the nurse notices white patches on the buccal mucosa. The nurse tries to obtain a sample for a culture, but the lesion cannot be rubbed off. The nurse would suspect that this lesion is A. Xerostomia. B. Candidiasis. C. Leukoplakia. D. Stomatitis. Answer: C. Leukoplakia. Explanation: A. Xerostomia is dry mouth. B. Candidiasis can be rubbed off, but it will bleed. C. Leukoplakia cannot be rubbed off. D. Stomatitis is caused by candidiasis and gram-negative bacteria. Question 306. A client's transfusion of packed red blood cells has been infusing for 2 hours. She is complaining of a raised, itchy rash and shortness of breath. She is wheezing, anxious, and very restless. The nurse knows these assessment findings are congruent with A. Hemolytic transfusion reaction, B. Febrile transfusion reaction, C. Circulatory overload, D. Allergic transfusion reaction. Answer: D. Allergic transfusion reaction. Explanation: A hemolytic transfusion reaction would be characterized by fever, chills, chest pain, hypotension, and tachypnea. B. Fever, chills, and headaches are indicative of a febrile transfusion reaction. C. Circulatory overload is manifest by dyspnea, cough, and pulmonary crackles. D. Urticaria, pruritus, wheezing, and anxiety are indicative of an allergic transfusion reaction. Question 307. A 30-year-old client is exhibiting auditory hallucinations. In working with this client, the effective if the nurse A. encourages the client to discuss the voices, B. attempts to direct the client's attention to the here and now, C. exhibits sincere interest in the delusional voices, D. gives the medication as necessary for the acting out behavior. Answer: B. attempts to direct the client's attention to the here and now. Explanation: A. This answer is incorrect. Encouraging discussion of the voices will reinforce the delusion. B. This answer is correct. The nurse should appropriately present reality. C. This answer is incorrect. Showing interest would reinforce the delusional system. D. This answer is incorrect. The statement only indicates that the client is hearing voices. It does not state that the client is acting out. Question 308. Parents of children receiving chemotherapy should be warned that alopecia is a side effect and that A. Children seldom show concern about losing their hair. B. The hair will come out gradually, and the loss will not be noticeable for some time. C. It is best for girls to choose a wig similar to their hairstyle and color before the hair falls out. D. The parents will soon get used to seeing their children without hair, and it will no longer bother them. Answer: C. It is best for girls to choose a wig similar to their hairstyle and color before the hair falls out. Explanation: A. Children may become depressed with a changed appearance and not want to look at themselves or have others see them. B. The hair will fall out in clumps, causing patchy baldness that is quite noticeable and traumatic to children and their families. C. Having a wig that looks like a girl's own hair can be a psychological boost to children and is helpful in fostering later adjustments to hair loss. D. Families may become accustomed to seeing their children without hair, but the loss is traumatic to them and will continue to bother them. Question 309. A client had a right below-the-knee amputation 4 days ago. He is complaining of pain in his right lower leg. The nurse should A. Remind the client that he no longer has that part of his leg and assure him he will be okay. B. Call the physician to request a psychological consultation for the client. C. Turn on the television to distract the client's attention from his amputated leg. D. Give the client his order of Demerol 50 mg IM/PRN. Answer: D. Give the client his order of Demerol 50 mg IM/PRN. Explanation: A. The nurse is ignoring the client's pain. Telling the client that he will be okay will not relieve his phantom pain. B. The client does not need a psychological consultation. Phantom pain is a normal sensation experienced by clients with amputations. C. Using the television as a distractor will not relieve the client's phantom pain. D. Phantom pain is a normal, very real experience for an amputee and should be treated with pain medication. Question 310. A 68-year-old man was recently diagnosed with end-stage renal disease. He has not yet begun dialysis but is experiencing severe anemia with associated symptoms of dyspnea. Describes the management of anemia in renal failure. A. Hematocrit levels usually remain slightly below normal in clients with renal failure. B. Transfusion is often begun as early as possible to prevent complications of anemia such as dyspnea and angina. C. Anemia in renal failure is frequently caused by low serum iron and ferritin and corrected by oral iron and ferritin replacement therapy. D. The renal secretion of erythropoiesis is decreased. The bone marrow requires erythropoietin to mature red blood cells. Answer: D. The renal secretion of erythropoiesis is decreased. The bone marrow requires erythropoietin to mature red blood cells. Explanation: A. Clients in renal failure typically have very low hematocrits, often in the range of 1,622%. B. Transfusion is avoided unless the client exhibits acute symptoms such as dyspnea, chest pain, tachycardia, and extreme fatigue. When the client is given a transfusion, the bone marrow adjusts by producing less red blood cells. C. Anemia in renal failure is caused primarily by decreased erythropoietin. Low serum iron and ferritin may aggravate the anemia and require treatment. D. Decreased secretion of erythropoietin by the kidney is the primary cause of anemia. The bone marrow requires this hormone to mature red blood cells. Treatment is with replacement therapy. Question 311. A client has just been transferred to the floor from the labor and delivery unit following delivery of a stillborn term infant. She is very despondent. When the nurse attempts to take her vital signs, she responds in anger, stating, "You leave me alone. You don't care anything about me. It's people like you who let my baby die." The nurse's best course of action is to A. Quietly leave her room, allowing her more private time to deal with her loss. B. Tell her that what happened was for the best and that she is still young and can have other children. C. Tell her how sorry you are, and let her know that her child is now a little angel in heaven. D. Tell her how sorry you are about the loss of her baby, and acknowledge her anger as being a normal stage of grief. Assure her that you are there to help her in any way you can. Answer: D. Tell her how sorry you are about the loss of her baby, and acknowledge her anger as being a normal stage of grief. Assure her that you are there to help her in any way you can. Explanation: A. Parents do need their privacy following a loss, but the nurse still has a responsibility to provide postpartum physical care. B. This is a negative statement, which is not therapeutic. The client is not concerned about future children but is in the first stages of grief, denial, and anger. C. This is a negative statement, which is not therapeutic. The client does not want to hear about her baby in heaven. She cannot believe that God could love or want her child more than she could. D. Acknowledging that anger is normal and beneficial will help the client to understand the normal stages of grief. Expressing sorrow over her loss and assuring her that the support is there to take care of her physical and emotional needs will help to promote a trusting relationship. Question 312. A client had a hemicolectomy performed 2 days ago. Today, when the nurse assesses the incision, a small part of the abdominal viscera is seen protruding through the incision. This complication of wound healing is known as A. Excoriation, B. Dehiscence, C. Decortication, D. Evisceration. Answer: D. Evisceration. Explanation: A. Excoriation is abrasion of the epidermis or of the coating of any organ of the body by trauma, chemicals, burns, or other causes. B. Dehiscence is a partial or complete separation of the wound edges with no protrusion of abdominal tissue. C. Decortication is removal of the surface layer of an organ or structure. It is a type of surgery, such as removing the fibrinous peel from the visceral pleura in thoracic surgery. D. Evisceration occurs when the incision separates and the contents of the cavity spill out. Question 313. During an examination, the nurse notes that an infant has diaper rash on the convex surfaces of his buttocks, inner thighs, and scrotum. Which of the following nursing interventions will be most effective in resolving the condition? A. Coating the inflamed areas with zinc oxide. B. Using talcum powder on the inflamed areas to promote drying. C. Removing the diaper entirely for extended periods of time. D. Cleaning the inflamed area thoroughly with disposable wet wipes at each diaper change. Answer: C. Removing the diaper entirely for extended periods of time. Explanation: A. Zinc oxide is not usually applied to inflamed areas because it contributes to sweat retention. B. Talcum powder is of questionable benefit and poses a hazard of accidental inhalation. C. Removing the diaper and exposing the area to air and light facilitate drying and healing. D. Infants may be sensitive to one or more agents in the wet wipes. It is better to simply clean with a wet cloth. Question 314. When providing dietary teaching to an individual who has diabetes mellitus, type 2, the nurse discusses the importance of consuming the recommended daily allowance of which of the following electrolytes? A. Potassium. B. Magnesium. C. Sodium. D. HCO3. Answer: B. Magnesium. Explanation: A. Potassium intake that meets the recommended daily allowance is important, especially in clients who have a history of cardiac disease. B. Low levels of magnesium can cause an increase in resistance to insulin and can lead to carbohydrate intolerance. C. Sodium is an important electrolyte for all clients but has no direct effect on diabetes mellitus. D. Bicarbonate plays an important role in acid-base balance. It is equally necessary for maintenance of all body functions. Question 315. A 55-year-old client is admitted with a diagnosis of renal calculi. He presented with severe right flank pain, nausea, and vomiting. The most important nursing action for him at this time is: A. Intake and output measurement. B. Daily weights. C. Straining of all urine. D. Administration of O2 therapy. Answer: C. Straining of all urine. Explanation: A. Intake and output measurements are important but must be accompanied by straining urine. B. Daily weights would not provide for identification of calculi. C. Straining urine provides for assessment of calculi and evaluation of calculi descent through ureters and urethra. D. O2 therapy should not be necessary for renal calculi. Question 316. A client is having a pneumonectomy done today, and the nurse is planning her postoperative care. Nursing interventions for a postoperative left pneumonectomy would include: A. Monitoring the chest tubes. B. Positioning the client on the right side. C. Positioning the client in semi-fowler position with a pillow under the shoulder and back. D. Monitoring the right lung for an increase in RELs. Answer: D. Monitoring the right lung for an increase in RELs. Explanation: A. Chest tubes are usually not necessary in a pneumonectomy because there is no lung to re-expand on the operative side. B. The pneumonectomy client should be positioned on the back or operated side because the sutured bronchial stump may open, allowing fluid to drain into the unoperated side and drown the client. C. The client should not have a pillow under the shoulder and back because of the subscapular incision. D. RELs are commonly heard over the base of the remaining lung, but an increase could indicate circulatory overload and therefore should be closely monitored. Question 317. While changing the dressing on a client's central line, the nurse notices redness and warmth at the needle insertion site. Which of the following actions would be appropriate to implement based on this finding? A. Discontinue the central line. B. Begin a peripheral 4. C. Document in the nurse's notes and notify the physician after redressing the site. D. Clean the site well and redress. Answer: C. Document in the nurse's notes and notify the physician after redressing the site. Explanation: A. The nurse may never discontinue a central line without a physician's order. B. The nurse may never initiate a peripheral 4 without a physician's order except in an emergency situation. C. The nurse should always document findings and alert the physician to the findings as well. The physician may then initiate a new central line and order the current central line to be discontinued. D. Besides cleaning and redressing, the nurse should always document the findings. Question 318. Which of the following serum laboratory values would the nurse monitor during gentamicin therapy? A. Creatinine. B. Sodium. C. Calcium. D. Potassium. Answer: A. Creatinine. Explanation: A common side effect of gentamicin is nephrotoxicity. The serum laboratory test that best reflects kidney function is serum creatinine. B. Serum sodium has no relationship to gentamicin. C. Serum calcium has no relationship to gentamicin. D. Serum potassium has no relationship to gentamicin. If a client has impaired renal function secondary to gentamicin administration, he or she may also have hyperkalemia as a secondary disorder. Question 319. A 68-year-old client developed acute respiratory distress syndrome while hospitalized for pneumonia. After a respiratory arrest, an endotracheal tube was inserted. Several days later, numerous attempts to wean him from mechanical ventilation were ineffective, and a tracheostomy was created. For the first 24 hours following tracheostomy, it is important to minimize bleeding around the insertion site. The nurse can accomplish this by A. Deflating the cuff for 10 minutes every other hour instead of 5 minutes every hour. B. Avoiding manipulation of the tracheostomy including cuff deflation. C. Reporting any signs of crepitus immediately to the physician. D. Changing tracheostomy dressing only as necessary using 1/2 strength hydrogen peroxide to cleanse the site. Answer: B. Avoiding manipulation of the tracheostomy including cuff deflation. Explanation: A. The tracheal cuff should not be deflated within the first 24 hours following surgery. B. To minimize bleeding, any manipulation, including cuff deflation, should be avoided. C. Small amounts of crepitus are expected to occur, however, large amounts or expansion of the area of crepitus should be reported to the physician. D. The tracheostomy site may be changed as often as necessary, but site care should be done with normal saline. Question 320. A 48-year-old client presents with a long history of severe depression unrelieved by medication. He is admitted to the hospital for electroconvulsive therapy. Family members are very concerned about this therapy and are requesting information about after effects of the treatment. The nurse informs the family that he will A. Have transient memory loss, confusion, and headache. B. Be alert and oriented immediately after the treatment. C. Have insomnia for the first few days. D. Require no special care after the procedure. Answer: A. Have transient memory loss, confusion, and headache. Explanation: A. This answer is correct. The client will be confused and have a memory loss, which is usually temporary, after electroconvulsive shock therapy. B. This answer is incorrect. The client will experience transient memory loss, look bewildered, and be confused initially. C. This answer is incorrect. The client will sleep immediately following the treatment. D. This answer is incorrect. Vital signs are taken at least hourly after treatment. The client is monitored for hypotension, tachycardia, respiratory problems, and possible seizure activity. Question 321. A client has been admitted to the nursing unit with the diagnosis of severe anemia. She is slightly short of breath, has episodes of dizziness, and complains her heart sometimes feels like it will beat out of her chest. The physician has ordered her to receive 2U of packed red blood cells. The most important nursing action to be taken is A. Starting an 18-gauge 4 infusion. B. Having the consent form on the chart. C. Administering the correct blood product to the correct client. D. Transfusing the blood in a 2-hour time frame. Answer: C. Administering the correct blood product to the correct client. Explanation: A. An 18-gauge 4 is an appropriate size for administering blood, however, client safety demands that the right blood product must be administered. B. The consent form is legally necessary to be on the chart, but client safety is maintained by giving the correct blood component to the correct client. C. Administering the correct blood product to the correct client will maintain physiological safety and minimize transfusion reactions. D. The blood administration should take place over the ordered time frame designated by the physician. Question 322. A client has been diagnosed with congestive heart failure. His fluid intake and output are strictly regulated. For lunch, he drank 8 ounces of milk, 4 ounces of tea, and 6 ounces of coffee. His intake would be recorded as A. 500 milliliters. B. 540 milliliters. C. 600 milliliters. D. 655 milliliters. Answer: B. 540 milliliters. Explanation: A, C, D. This answer is a miscalculation. B. 1 ounce equals 30 milliliters, therefore, 18 ounce X. Question 323. A 40-year-old client is admitted to the coronary care unit with chest pain and shortness of breath. The physician diagnosed an anterior wall myocardial infarction. What test should the nurse anticipate? A. Respiratory count, creatinine phosphokinase, CPK. B. Aspartate transaminase, alanine transaminase. C. Sedimentation rate, WBC count. D. Lactic dehydrogenase, CPK. Answer: D. Lactic dehydrogenase, CPK. Explanation: A. Respiratory count measures the number of immature erythrocytes. CPK is an enzyme released from injured myocardial tissue. B. Aspartate transaminase is an enzyme released from injured myocardial tissue. Alanine transaminase is an enzyme released for general tissue destruction, which is specific for liver injury. C. Sedimentation rate is a nonspecific test for inflammation. D. Lactic dehydrogenase and CPK are enzymes released from injured myocardial tissue. Question 324. A 60-year-old woman exhibits forgetfulness, emotional lability, confusion, and decreased concentration. She has been unable to perform activities of daily living without assistance. After a thorough medical evaluation, a diagnosis of Alzheimer's disease was made. An appropriate nursing intervention to decrease the anxiety of this client would include A. Allowing the client to perform activities of daily living as much as possible unassisted. B. Confronting confabulations. C. Reality testing. D. Providing a highly stimulating environment. Answer: A. Allowing the client to perform activities of daily living as much as possible unassisted. Explanation: A. This answer is correct. The more the client is able to control her daily routine, the less anxiety she will experience. B. This answer is incorrect. Confrontation tends to increase anxiety. C. This answer is incorrect. Reality testing is an assessment tool. It does not decrease anxiety. D. This answer is incorrect. A highly stimulating environment increases distractibility and anxiety. Question 325. A 25-year-old outpatient presents with a diagnosis of compulsive personality disorder. His coworkers become annoyed with his rigid, perfectionistic manner and preoccupation with trivial details and schedules. A nursing intervention appropriate for this client would include: A. Encouraging him to engage in recreational activities. B. Avoiding discussion of his annoying behavior. C. Encouraging the client to set a time schedule and deadlines for himself. D. Contracting with him for the amount of time he will spend on the compulsive behaviors. Answer: D. Contracting with him for the amount of time he will spend on the compulsive behaviors. Explanation: A. This answer is incorrect. The client will work hard at the activity instead of enjoying it. B. This answer is incorrect. The nurse should allow the client to discuss these thoughts, within limits, not to avoid discussing them. C. This answer is incorrect. The compulsive client tends to control time to excess. It should not be encouraged. D. This answer is correct. A contract with the client regarding the amount of time that will be spent discussing the compulsive activities is appropriate. Time allotted should be gradually decreased. Question 326. A client has returned to the unit from the recovery room after having a thyroidectomy. The nurse knows that a major complication after a thyroidectomy is: A. Respiratory obstruction. B. Hypercalcemia. C. Fistula formation. D. Myxedema. Answer: A. Respiratory obstruction. Explanation: A. Respiratory obstruction due to edema of the glottis, bilateral laryngeal nerve damage, or tracheal compression from hemorrhage is a major complication after a thyroidectomy. B. Hypocalcemia accompanied by tetany from accidental removal of one or more parathyroid glands is a major complication, not hypercalcemia. C. Fistula formation is not a major complication associated with a thyroidectomy. It is a major complication with a laryngectomy. D. Myxedema is hypothyroidism that occurs in adults and is not a complication of a thyroidectomy. A thyroidectomy client tends to develop thyroid storm, which is excess production of thyroid hormone. Question 327. The nurse documents a client's surgical incision as having red granulated tissue. This indicates that the wound is: A. Infected. B. Not healing. C. Necrotic. D. Healing. Answer: D. Healing. Explanation: A. The wound is not infected. An infected wound would contain pus, debris, and exudate. B. The wound is healing properly. C. A necrotic wound would appear black or brown. D. The wound is healing properly and is filled with red granulated tissue and fragile capillaries. Question 328. A 27-year-old prima gravida at 32 weeks gestation has been diagnosed with complete placenta previa. Conservative management including bed rest is the proper medical management. The goal for fetal survival is based on fetal lung maturity. The test used to determine fetal lung maturity is: A. Dinitrophenylhydrazine. B. Metachromatic stain. C. Blood serum phenylalanine test. D. Lecithin-sphingomyelin ratio. Answer: D. Lecithin-sphingomyelin ratio. Explanation: A. Dinitrophenylhydrazine is a laboratory test used to detect phenylketonuria, maple syrup urine disease, and Lowe's syndrome. B. Metachromatic stain is a laboratory test that may be used to diagnose Tay-Sachs and other lipid diseases of the central nervous system. C. The blood serum phenylalanine test is diagnostic of phenylketonuria and can be used for wide-scale screening. D. A lecithin-sphingomyelin ratio of at least 2:1 is indicative of fetal lung maturity, and survival of the fetus is likely. Question 329. A client has begun to exhibit signs of alcohol withdrawal. Her blood pressure has risen from 120/60 to 190 out of 100, pulse has increased from 88 to 110 bpm, and she is irritable and agitated and has gross motor tremors of the hands. The nurse notifies the doctor. The nurse can anticipate that the doctor will order which of the following? A. An opiate such as propoxyphene napsylate, Darvocet. B. A benzodiazepine such as chlordiazepoxide, Librium. C. A tricyclic antidepressant such as amitriptyline, Elavil. D. A phenothiazine such as chlorpromazine, Thorazine. Answer: B. A benzodiazepine such as chlordiazepoxide, Librium. Explanation: A. This answer is incorrect. Benzodiazepines are drugs of choice for alcohol withdrawal. B. This answer is correct. The drug has a sedative effect, is safe, and has an anticonvulsant effect. C. This answer is incorrect. Amitriptyline is an antidepressant. D. This answer is incorrect. Chlorpromazine is most effective in psychotic disorders. Question 330. A 32-year-old mother of two was brought to the hospital by her husband. He reported that his wife could no longer manage the house and children. She does not sleep and talks day and night. She has purchased some very expensive clothes. The nurse noted that the client speaks rapidly and changes the subject irrationally. This is an example of A. Flight of ideas. B. Delusions. C. Hallucinations. D. Echolalia. Answer: A. Flight of ideas. Explanation: A. Rapidly moving from one topic to another without following any logical sequence is called flight of ideas. B. False beliefs or delusions. C. False sensory perceptions are hallucinations, hearing voices. D. Repeating words is called echolalia. Question 331. 1 week ago, a 21-year-old client with a diagnosis of bipolar disorder was started on lithium 300 mg per QID. A lithium level is ordered. The client's level is 1.3 milliequivalent/L. The nurse recognizes that this level is considered to be A. Within therapeutic range. B. Below therapeutic range. C. Above therapeutic range. D. At a level of toxic poisoning. Answer: A. Within therapeutic range. Explanation: A. This answer is correct. The therapeutic range is 1.01.5 milliequivalent/L in the acute phase. Maintenance control levels are 0.61.2 milliequivalent/L. B. C. This answer is incorrect. A level of 1.3 milliequivalent/L is within therapeutic range. D. This answer is incorrect. Toxic poisoning is usually at the 2.0 level or higher. Question 332. A depressed client is seen at the mental health center for follow-up after an attempted suicide 1 week ago. She has taken phenylzine sulfate, Nardil, a monoamine oxidase, MAO, inhibitor, for 7 straight days. She states that she is not feeling any better. The nurse explains that the drug must accumulate to an effective level before symptoms are totally relieved. Symptom relief is expected to occur within A. 10 days. B. 2 to 4 weeks. C. 2 months. D. 3 months. Answer, B. 2 to 4 weeks. Explanation, A. This answer is incorrect. It can take up to 1 month for therapeutic effect of the medication. B. This answer is correct. Because MAO inhibitors are slow to act, it takes 24 weeks before improvement of symptoms is noted. C. This answer is incorrect. It can take up to 1 month for therapeutic effect of the medication. D. This answer is incorrect. Therapeutic effects of the medication are noted within 1 month of drug therapy. Question 333. In working with a manipulative client, which of the following nursing interventions would be most appropriate? A. Bargaining with the client as a strategy to control the behavior. B. Redirecting the client. C. Providing a consistent set of guidelines and rules. D. Assigning the client to different staff persons each day. Answer, C. Providing a consistent set of guidelines and rules. Explanation, A. This answer is incorrect. Bargaining is a manipulative act, which the nurse could expect from the client. B. This answer is incorrect. Confrontation is an effective nursing strategy with manipulative behavior. Redirection is appropriate for the client who is out of touch with reality. C. This answer is correct. Manipulative clients must abide by consistent rules. D. This answer is incorrect. Manipulation is kept at a minimum if the same staff person is assigned to the client. Often the client will attempt to play staff persons against each other. Question 334. A client is diagnosed with diabetic ketoacidosis. The nurse should be prepared to administer which of the following 4 solutions? A. D5 in normal saline. B. D5W. C. 0.9 normal saline. D. D5 in lactated ringers. Answer, C. 0.9 normal saline. Explanation, A. D5 in normal saline would increase serum glucose. B. D5W would increase serum glucose. C. A concentration of 0.9 ns is used to correct extracellular fluid depletion. D. D5 in ringers lactate would increase serum glucose. Question 335. A male client had a right below the knee amputation 4 days ago. His incision is healing well. He has gotten out of bed several times and sat at the side of the bed. Each time after returning to bed, he has experienced pain as if it were located in his right foot. Which nursing measure indicates the nurse has a thorough understanding of phantom pain and its management? A. Phantom pain is entirely in the client's mind. The client should be instructed that the pain is psychological and should not be treated. B. The basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. C. The cause of phantom pain is unknown. The nurse should provide the client with support, promote sleep, and handle the injured limb smoothly and gently. D. Phantom pain is caused by trauma, spasms, and edema at the incisional site. It will decrease when postoperative edema decreases. It should be treated with non-narcotic medication whenever possible. Answer, B. The basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. Explanation, A. This statement is entirely false. B. Phantom pain may be caused by nerves continuing to carry sensation to the brain even though the limb is removed. It is real, intense, and should be treated as ordinary pain would. C. Although the cause of phantom pain is still unknown, these measures may promote the relief of any type of pain, not just phantom pain. D. Phantom pain is not caused by trauma, spasms, and edema and will not be relieved by decreasing edema. Question 336. As a nurse works with an adolescent with cystic fibrosis, The nurse begins to notice that he appears depressed and talks about suicide and feelings of worthlessness. This is an important factor to consider in planning for his care because A. It may be a bid for attention and an indication that more diversionary activity should be planned for him. B. No threat of suicide should be ignored or challenged in any way. C. He needs to be observed carefully for signs that his depression has been relieved. D. He needs to be confronted with his feelings and forced to work through them. Answer: B. No threat of suicide should be ignored or challenged in any way. Explanation: A. Threats of suicide should always be taken seriously. B. This client has a life-threatening chronic illness. He may be concerned about dying or he may actually be contemplating suicide. C. Sometimes clients who have made the decision to commit suicide appear to be less depressed. D. Forcing him to look at his feelings may cause him to build a defense against the depression with behavioral or psychosomatic disturbances. Question 337. A physician tells the nurse that he wants to orally intubate a client with a number 8 endotracheal tube. The finding of normal breath sounds on the right side of the chest and diminished, distant breath sounds on the left side of the chest of a newly intubated client is probably due to A. A left hemothorax. B. A right hemothorax. C. Intubation of the right mainstem bronchus. D. An inadequate mechanical ventilator. Answer: C. Intubation of the right mainstem bronchus. Explanation: A. Although a left hemothorax could cause diminished and distant breath sounds, it is irrelevant to this situation. B. A right hemothorax will not cause diminished and distant breath sounds on the left side of the chest. C. The right mainstem bronchus is most frequently intubated in error because the angle of the right mainstem bronchus is very small as compared with that of the left mainstem bronchus. Because ventilation is only occurring on the right side, the nurse would auscultate diminished and distant breath sounds on the left. D. An inadequate mechanical ventilator has no relationship to this situation. Question 338. A 22-year-old client who is being seen in the clinic for a possible asthma attack stops wheezing suddenly as the nurse is doing a lung assessment. Which one of the following nursing interventions is most important? A. Place the client in a supine position. B. Draw a blood sample for arterial blood gases. C. Start O2 at 4 liters per minute. D. Establish a patent airway. Answer: D. Establish a patent airway. Explanation: A. During impending respiratory failure or asthmatic complications, the client is placed in the high Fowler position to facilitate comfort and promote optimal gas exchange. B. Arterial blood gases are monitored in the treatment of respiratory failure during an asthma attack, but it is not an initial intervention. C. O2 therapy is used during an asthma attack, but it is not the initial intervention. The usual prescribed amount is a cautiously low flow rate of 12 liters per minute. D. Wheezing is a characteristic clinical finding during an asthma attack. If wheezing suddenly ceases, it usually indicates a complete airway obstruction and requires immediate treatment for respiratory failure or arrest. Question 339. At her first prenatal visit, a 21-year-old woman who is gravida 2, para 0, ob 1, is currently at 32 weeks gestation and has a history of drug abuse, smoking, and occasional ethyl alcohol. Likely reason for the infant's intrauterine growth retardation is A. The client's young age. B. The client's previous abortion. C. The client's history of drug, ethyl alcohol, and tobacco use. D. The client's late prenatal care. Answer: C. The client's history of drug, ethyl alcohol, and tobacco use. Explanation: A. Although adolescents frequently have a higher incidence of low birth weight infants, this client is 21 years old. B. Uncomplicated induced abortions have not been proved to influence the growth of infants of subsequent pregnancies. C. Compounds in cigarettes and some illicit drugs cause maternal vasoconstriction and a subsequent reduction in O2 availability for the fetus owing to the resulting reduction in uteroplacental blood flow. As few as 1 or 2 drinks of alcohol per day will decrease birth weight. D. Although early prenatal care has been shown to improve pregnancy outcomes, not seeking care until the second week of gestation does not, in and of itself, cause intrauterine growth retardation. Question 340. Prior to administering digoxin to a client with congestive heart failure, the nurse needs to assess A. Respiratory rate for 1 minute. B. Radial pulse for 1 minute. C. Radial pulse for 2 minutes. D. Apical pulse for 1 minute. Answer: D. Apical pulse for 1 minute. Explanation: A. Respiratory rate is not directly affected by digoxin therapy. B. A radial pulse is not as accurate as an apical pulse. Dysrhythmias may not be detected. C. A radial pulse is not as accurate as an apical pulse, regardless of assessment time. D. Apical pulse should be measured for 1 minute prior to digoxin administration. Digoxin decreases the heart rate. Digoxin should be withheld if apical rates are NLT, 60 bpm or NGT, 120 bpm. Question 341. The client tells the nurse, "I have pain in my left shoulder." This is considered A. Evaluation process. B. Objective information. C. Subjective information. D. Complaining. Answer: C. Subjective information. Explanation: A. Evaluation process follows a nursing intervention. B. Objective information can be measured. C. Subjective information is provided by a person. D. Client is reporting a symptom that needs to be assessed. Question 342. A 37-year-old client has been taking antipsychotic medication for the past 10 days. The nurse observes her walking with a shuffling gait and postural rigidity and notes a mask-like expression on her face. Which side effect is this client exhibiting? A. Dystonia. B. Parkinsonism. C. Tardive dyskinesia. D. Akathisia. Answer: B. Parkinsonism. Explanation: A. This answer is incorrect. Dystonia refers to severe, painful muscle contractions. B. This answer is correct. Parkinsonism commonly occurs approximately 12 weeks after initiation of antipsychotic drug therapy. Traditional signs are mask-like facies, postural rigidity, shuffling gait, and resting tremor. C. This answer is incorrect. Tardive dyskinesia is characterized by involuntary muscle movements of the face, jaw, and tongue. D. This answer is incorrect. Akathisia is motor restlessness. Question 343. A female client has been hospitalized for several months following major abdominal surgery for a ruptured colon. A colostomy was created, and the large abdominal wound was left open and allowed to heal through granulation. She is receiving gentamicin 4 for treatment of wound infection. Knowing this drug is ototoxic, the nurse would implement which of the following measures? A. Instruct the client to report any signs of tinnitus, dizziness, or difficulty hearing. B. Advise the client to discontinue the drug at the first sign of dizziness. C. Order audiometric testing in order to determine if hearing loss is caused by an ototoxic drug or other cause. D. Instruct the client in Valsalva's maneuver to equalize middle ear pressure and to prevent hearing loss. Answer: A. Instruct the client to report any signs of tinnitus, dizziness, or difficulty hearing. Explanation: A. The first nursing measure is to instruct the client in which drug side effects to report. B. Discontinuing the drug is not an independent nursing intervention and may compromise client care. C. Audiometric testing will detect hearing loss, but it does not indicate a potential cause. D. Equalizing middle ear pressure will not prevent hearing loss. Question 344. A 2-day-old infant boy has been diagnosed with an atrial septal defect due to a persistent patent foramen ovale. When explaining the diagnosis to the mother, the nurse includes in the discussion the function of the foramen ovale. In fetal circulation, the foramen ovale allows a portion of the blood to bypass the A. Left ventricle, B. Pulmonary system, C. Liver, D. Superior vena cava. Answer: B. Pulmonary system. Explanation: A. The foramen ovale permits a percentage of the blood to shunt from the right atrium to the left atrium. The blood then goes to the left ventricle, permitting systemic fetal circulation with blood containing a higher O2 saturation. B. As the blood shunts from the right atrium to the left atrium, the pulmonary system is bypassed. The fetus receives O2 from the maternal circulation, thereby permitting the partial bypass of the pulmonary system. C. The foramen ovale is located in the atrial septum of the heart and does not affect the liver. D. The superior vena cava returns blood to the heart, bringing blood to the location of the foramen ovale. Question 345. The parents of a 2-year-old child are ready to begin toilet training activities with him. His parents feel he is ready to train because he is now 2 years old. What would the nurse identify as readiness in this child? A. Patience by the child when wearing soiled diapers. B. Communicating the urge to defecate or urinate. C. The child awakening wet from his naps. D. The age at which the child's siblings were trained. Answer: B. Communicating the urge to defecate or urinate. Explanation: A. Children experience impatience with soiled diapers when readiness for training is apparent. They often desire to be changed immediately. B. A child must be able to use verbal or nonverbal skills to communicate needs. C. A readiness indicator would be awaking dry from naps. D. The age at which a sibling was toilet trained has no implications for training this child. Question 346. Nursing care for the parents of a child with a congenital heart defect would include: A. Encouraging the parents not to tell the child about the seriousness of the congenital heart defect, so the child will function as normally as possible. B. Acknowledging the fear and concern surrounding their child's health and assisting the parents through the grieving process as they mourn the loss of their fantasized healthy child. C. Identifying anger and resentment as destructive emotions that serve no purpose. D. Expressing to the parents after the corrective surgery has been completed successfully that all their grief feelings will resolve. Answer: B. Acknowledging the fear and concern surrounding their child's health and assisting the parents through the grieving process as they mourn the loss of their fantasized healthy child. Explanation: A. It is important to discuss with parents the need to treat the child as they would any other children, but they must be truthful and honest with the child about the heart defect. As the child grows older, explanations can go into greater depth. B. Parents of children with congenital heart defects go through a grieving process over the loss of their healthy child. The nurse needs to recognize these feelings and give the parents a role in the child's care when they are ready. C. Anger and resentment are normal feelings that must be dealt with appropriately. D. Parents may go through a second grieving process after the repair of the cardiac defect. During this grieving period, they mourn the loss of the defective child who now may be essentially normal. Question 347. A 10-year-old client with a pin in the right femur is immobilized in traction. He is exhibiting behavioral changes including restlessness, difficulty with problem solving, inability to concentrate on activities, and monotony. Which of the following nursing implementations would be most effective in helping him cope with immobility? A. Providing him with books, challenging puzzles, and games as diversionary activities. B. Allowing him to do as much for himself as he is able, including learning to do pinsight care under supervision. C. Having a volunteer come in to sit with the client and to read him stories. D. Stimulating rest and relaxation by gentle rubbing with lotion and changing the client's position frequently. Answer: B. Allowing him to do as much for himself as he is able, including learning to do pinsight care under supervision. Explanation: A. These activities could be frustrating for the client if he is having difficulty with problem solving and concentration. B. Self-care is usually well received by the child, and it is one of the most useful interventions to help the child cope with immobility. C. This may be helpful to the client if he has no visitors, but it does little to help him develop coping skills. D. This will help to prevent skin irritation or breakdown related to immobility but will not help to prevent behavioral changes related to immobility. Question 348. A mother called the physician's office to ask if it would help relieve her small daughter's abdominal pain if she gave an enema and placed a heating pad on the abdomen. Her daughter has a fever and has vomited twice. The nurse's response is based on the knowledge that A. The symptoms could easily have been caused by constipation, which an enema would relieve. B. Heat would help to relax the abdominal muscles and relieve her pain. C. Both heat and enemas stimulate intestinal motility and could increase the risk of perforation. D. Complaints of stomachache are common in young children and are generally best ignored. Answer: C. Both heat and enemas stimulate intestinal motility and could increase the risk of perforation. Explanation: A. Constipation does not cause fever or vomiting but may cause anorexia. Risk of perforation outweighs the possible benefits of an enema. B. Heat will not relieve her symptoms but will increase intestinal motility and increase the risk of perforation. C. Heat and enemas are contraindicated where severe abdominal pain is suspected because they increase intestinal motility and the risk of perforation. D. Complaints accompanied by physical symptoms such as pain, anorexia, and fever should never be ignored. Question 349. A client on the infectious disease unit is discussing transmission of human immunodeficiency virus, HIV. The nurse would need to provide more client education based on which client statement? A. HIV is a virus transmitted by sexual contact. B. Condoms reduce the transmission of HIV. C. HIV is a virus that is easily transmitted by casual contact. D. HIV can be transmitted to an unborn infant. Answer: C. HIV is a virus that is easily transmitted by casual contact. Explanation: A. HIV is transmitted through unprotected sexual contact. B. Condoms are an effective barrier to prevent HIV transmission. C. HIV is not easily transmitted by casual contact. D. HIV can be transmitted intrauterine at the time of delivery, and by breastfeeding. Question 350. A 70-year-old homeless woman is admitted with pneumonia. She is weak, emaciated, and febrile. The physician orders enteral feedings intermittently by nasogastric tube. When inserting the nasogastric tube, once the tube passes through the oropharynx, the nurse will instruct the client to A. Tilt her head backwards. B. Swallow as tube passes. C. Hold breath as tube passes. D. Cough as tube passes. Answer: B. Swallow as tube passes. Explanation: A. Head should be tilted slightly forward to facilitate insertion. B. Swallowing assists with insertion of tube and closes off airway. C. Client should be swallowing as tube passes, holding the breath facilitates nothing. D. Coughing may expel tube. If you're finding this series helpful, please like, subscribe, and turn on notifications so you never miss the next episode of our complete 862-question NCLEX-RN 2026 practice series.